my name's Helen. I work for the Agence AXA International in France, and my specialism is in healthcare. So hopefully I'm going to be able to take you through some of the terminology you're going to need and some of the things you're going to need in order to get registered and how to access the system. So first, if I tell you a little bit about our agency, who we are and what we do. We are a dedicated English-speaking agency, and we're based in the southwest of France, but we are staffed with English speakers, the vast majority of us native English, and we all have experience in insurance and banking in the United Kingdom, Ireland, USA, and beyond, to be honest. And we offer our specialist service for English speakers across the whole of France. And hopefully we can guide you through. So looking at insurance, if we look at what you need to do before you even arrive, because this is often quite a big concern for people, there's a few different things we can cover. So looking at, I would say for UK citizens, but also anybody coming from other countries in the EU to France, you can look at the S1. And the S1, basically, and I know Peter referred to this earlier, it's quite a powerful document. And you need to be of retirement age in the country that you were working in, and you can apply for this document, and it basically gives you exportable benefits. And you will be able to come to France, register for a social security number immediately, and access the system straight away, and the costs will be back charged to the country. I mean, I know for lots of people it's going to be the UK, but it's the same for other EU countries too. And very powerfully, you can use this as your health insurance when you're applying for the one-year visa if you need to do that. You don't need an additional insurance. The S1 is suitable for that purpose. In order to support that, I would definitely recommend, although the S1 is powerful and it does give you cover, and you can immediately register with that when you arrive in France, moving to a new country, it can be quite overwhelming. There's a lot to do, there's a lot to understand. So I would recommend that you have a temporary health insurance cover that will provide cover for you in case of accidents or emergencies. Nobody wants to think anything's bad's going to happen, but you know, just in case something happens, this can give you cover while the social security registration takes place and all the paperwork is done, just to give you a bit of peace of mind. But it doesn't necessarily have to be the same level of cover as you would need for a visa application. So then, talking of visa applications, you do need health insurance to support that. And if you are coming from a country that doesn't have an S1 and you don't have access to that, or if you're early retired and you're not yet at retirement age in your country, you will need an additional insurance to support that visa application. There's some quite specific requirements it has, the minimum cover level, it must include repatriation. The UK visa application centres are being very much more specific about what they require. So again, I would recommend you speak to somebody who has experience of these kind of policies and make sure that you get something that is suitable for your visa. If you're not looking at a permanent move, then you possibly need just a Schengen travel insurance policy, because coming to France, you need to make sure that you're covered for the whole of the Schengen zone. Even the full visa insurance will cover you for the Schengen zone, and that is part of the requirement. Because once you're in France, obviously you're going to have freedom of movement, and they need to, the authorities need to know that you're covered for all of those countries. If you're coming for shorter periods of time, you can get quite good and cost-effective Schengen insurances up to 6 months at a time. If we then move on and think about the French health system itself, so this is going to be a bit further down the line when you're registered. What I'm going to do with the next 2 slides is talk a little bit about some of the terminology you might have heard. And if you haven't heard it already, this is something that will come along, and hopefully this will make it all just a little bit more familiar for you when you're actually doing your registration. One of the things I think a lot of people have heard of is PUMA, and this is Protection Universelle Maladie. And this has been in place since 2016. And rather than being an actual procedure or a process or a place, what it is, it's the French that have put in law that it gives you the right to healthcare in France once you are considered to be legally resident. And in practice, what this means is that once you have lived in France for 3 months and that you can demonstrate that you are legally and stably resident with your visa, with your income, that you fulfill the requirements, then you are entitled to apply to join the French healthcare system. Now, for most people, that's probably going to be a no-brainer. It's a good system, you can get straight in there. However, for some people, it might be something you need to look at, discuss with your accountant, certainly discuss with your tax advisors such as Blevin Franks, because when you are in the French health system, you will also be required to make social security contributions in order for that care, unless you have, as we've said, the previously the S1 form, or you're already paying because you work there. So it's just something to be aware of and to think about. Another one you will come across is CPAM, the Caisse Primaire Assurance Maladie, and that's the main health fund. This is the people who manage the contributions and they manage the payments that are made to you when you get your healthcare. Some of the other things, just to bear in mind, this obviously people are coming from all sorts of different countries that have been in lots of different systems, but generally in France, access to healthcare is not free at point of access. When you go to the doctor, you will normally have to pay. And then once you have your social security number and then eventually your carte vitale, you will receive reimbursements directly to your bank account. There are exceptions to this, and I think the whole French system is built on exceptions, if I'm honest. So there are some points where you will not be expected to pay visits to Agence or accident emergency, for example. One of the biggest differences people will see is that when you do have your social security number, the French social security system refunds a percentage of the cost that you pay. The social security system has a set fee for every procedure, and this is known as the base de remboursement. And then they have this figure is associated with every treatment you can think of, from a visit to the doctor to an X-ray on your ankle to an X-ray on your little finger. Each one is different. And then you will receive a percentage of this fee. So simplest example is seeing the general doctor, where the base de remboursement is €25 and you will receive 70% back. In practice, this means there's a €7.50 additional charge that you would be expected to pay out of pocket, or this is where people then have a Mutuelle Top Up policy. And obviously, looking at €7.50 to see the doctor, that is relatively trivial. It's not too big a deal. However, the reason you really should consider a Mutuelle Top Up policy is there are things where doctors, specialists, areas will charge a great deal more than the base de remboursement on the social security set fee. And you're going to see when we come on to the Mutuelle later how that actually works. Just to go through a few more of the items on the next slide, just a few other things for you to be aware of. You'll know, I'm sure, if you've started to look at the French system, the carte vitale. This is your personalised card with the chip that the doctors and other practitioners can use to access directly your records and also process and generate your reimbursements. You can get reimbursements before you receive this card. As soon as you receive a temporary social security number, you can access the French system. It just means you're going to have to request your reimbursements manually. But to be honest, I think for most people, the day you receive your actual carte vitale is an opening of champagne moment, because it feels you're finally there. You will come across, again, Amelie.fr. Now, Amelie is the overall website that manages, it's got all the information on reimbursements, where to go, and here you can access your Amelie account, which takes you straight into your healthcare account, where you can, very powerful, you can manage your reimbursements, access your carte vitale, access all your information. Really, really powerful, and definitely worth getting set up. We have doctors here from medicine traitant through to specialist consultants. A lot of this you can access through some of the systems. You can search, you can see them on your system. Prescriptions fall into different categories in France. Although we've got white, blue and orange label here on the slide, actually there's also the category of non-reimbursable medicines. And in my experience, just because you're issued with a prescription from a doctor or a consultant, it doesn't necessarily mean that it will be a reimbursable medicine. But I do also find pharmacists are very good at helping guide you through the different reimbursements. So a white medicine, for example, which is going to be things like antibiotics, painkillers, highly clinically effective medicines, they will be reimbursed by the state at about 65%. Blue is medicines which are recognised clinical effectiveness, but not as high priority as the white, and they're reimbursed at around 35%. An orange label, which are things like cough mixtures, cough medicines, and they're around 10% from the state. So this is where a Mutuelle can start to step in. Things to bear in mind, things like hospital visits, treatments and transport can all be treated in different ways. Some of the charges that you'll receive outside of the state reimbursement can be quite high, particularly with things like ambulances and with consultant fees. And just one, particularly for people who are retired, possibly to think about or to be aware of, is there is a status known as ALD, which is affection longue durée in France. And this is for long-term health conditions, and this covers diabetes, heart disease, multiple sclerosis, cancer. There's a really long established list. And if your illness falls within one of these categories, you will receive enhanced reimbursements. But just bear in mind, the enhanced reimbursements that you'll receive are for that illness only. And if a doctor, whilst treating that illness, does charge above the bas de remboursement, you would still be liable for that charge. A really good example of that would be somebody with diabetes who needs to see a dermatologist or a podologist. They often charge higher than the set fee, and you will need to pay those additional fees. So just to bear that in mind. So if we just step onto Mutuelle Top Up Insurance, it's something I think you need to think about and you need to be aware of when you're setting your budget, because it's quite common in France. I would say the vast majority of French people do have a Mutuelle Top Up policy, but the cover can vary enormously. So in effect, this is to cover the difference between the physical cost that you pay for your treatment and the refund that you receive from CPAM. And in some cases, this might be trivial, €7.50 for seeing a doctor. And in other cases, this can be €600 for an ambulance, which has been my own personal experience. Your Mutuelle will be automatically linked to your account with CPAM in many cases. And that means that the reimbursements will be generated automatically for you and everything will happen behind the scenes. Mutuelle will also help to cover the cost of a private room in hospital, which is quite common in France, but is not covered by the state. Also complementary treatments such as osteopath, chiropractor, etc. Again, these are things that are not covered by the state. Counsellors, psychologue, also not covered by the state. So Mutuelle can give you good cover for these. One of the important areas is that they provide enhanced cover for private clinics and specialists. If you choose to see people who are very experienced and highly regarded in their scene, you can find they'll charge 200%, double the set fee, or if, in some cases, a great deal more. One particular clinic, American Hospital in Paris, will charge many times the bas de remboursement for their doctors. One little thing which is often not considered with a Mutuelle is they can help and step in with some additional services if you have to be hospitalised, such as helping organise, get you to hospital and get you home. They can organise home help when you are home for shopping, bit of housework, gardening, if you need help and assistance with that. Somebody to look after your pets, and obviously for people who are studying, a bit of study support, but probably not as relevant for you here today. The Mutuelle is a minefield, and it can be a minefield, and I would always recommend that you speak to somebody who is a specialist, who understands this well, who can go step by step with you through your personal situation and look at exactly what you need and with your budget and your situation and find a good solution, because we can go all the way from a policy which will only cover you for an inpatient hospital stay, like the Hospitradi here, right up to 400% policies, which will give you really kind of high level cover for, you know, things across the board. We can look at, excuse me, options for enhancing cover just when you're in hospital, for optical, dental, and for complementary treatment. Just a quick word on optical dental, because the real costs of most optical dental treatment in France is way, way above the set cost. So if optical and dental treatment is important to you, then that is really something to focus on when you're looking at a mutuelle. Just to finish off, obviously health insurance is part of the whole package. Before you arrive in France, it's worth thinking about having things set up. So we can help you look at exactly what you need to think about to have a bank account set up so you can get here. Property insurance, which is quite different in France to other countries. So just so you're aware of the differences and what you need to think about. And with vehicle insurance, often to just think about what documents you need to have ready before you arrive in France. These are just things to have at the back of your mind once you're starting on this journey. And obviously we can help advise with that. Thanks for your time. I hope it hasn't been too confusing. I know there's a lot of terminology with health insurance, but I hope some of this today has just helped you to get some of this fixed in your mind so that when you start on the journey, it makes a little bit more sense.